And viewers, and as an innovator, this is super exciting, by the way. I love what you're talking about. I kind of feel like, oh, can we go get started? Yeah. Let's. I have all kinds of ideas. Let's just go.
Yeah. We just followed some very definite principles. We committed to prototyping. That we were going to just take feedback from everywhere. We just, if something worked, we did a little more. If something didn't work, we found out why.
Yeah, love it.
We wanted people to come here and be inspired.
Sure. And it already, there is an energy. And you mentioned that, like, sort of the culture of it and the support, which is so incredible, has to be from the senior level down through the institution, has to really let people feel inspired and no idea is silly or stupid or whatever, you know what I mean? And then what I'm real curious about, though, just right from the get-go is, so you mentioned a nurse, so maybe we can start there, or any that comes to mind in the 2 years. Give us an example of a continuum of a successful project.
We have two levels. When we started, David said, let's just run. We're not going to charge anything. Of course, Doug was putting a lot of money into it. But it was really about internal projects here.
So almost for cost reduction and efficiency and work and that kind of thing?
So you have process innovations and product innovation.
Okay.
Really have early on what we focused on. They're quick to kind of do, but if you have a problem out in an area, like I give you an example, our leader over patient access, the people who register patients and collect co-pays and deductibles and all those items, brought a project to the lab to say, how can we do this process better? Because we're not hitting our goals and metrics on collections, and we also have a dynamic around the whole experience that isn't hitting the goals and the metrics around experience that we're after either. And so they came to the lab, and it was a team of people from patient access, people from nurses from the emergency room, nurses from the floors, and I think even some people from transportation that were all part of the project. And then
the ED.
And they went out and they did, so as part of that group, they did their empathy work.
They connected with the end user. They went through
the end user, deep empathy from the viewpoint of the end user.
Okay.
They experienced when patients were coming into ED. They became patients.
Wow.
And then they all see each other's perspective and how they play into it. So the ER nurse seeing the perspective of the patient access, the register, and the nurse on the floor experiencing and seeing, what's, and they came up with an idea, and they actually went and prototyped it, and in the prototype phase realized that it actually didn't work. So it was a great idea, but their first pass
first prototype they lost like $120,000.
But they took that feedback.
Said, keep going.
Wait. Did you say, what did you say they lost?
Their first prototype, they lost $120,000.
So their collections did. Don't give up. That's feedback.
Yeah. Oh, for sure.
Because their problem was all these hospitals. This huge hospital, they were coming in the last on collections for ED collections every single month for years.
Wow. Okay.
And so they said, how might we redesign our collection process and for a better patient experience?
Wow.
And so,
so they came back to the lab and they redid their process. And,
they were really discouraged when they came back, and they said it didn't work. We said no. Sometimes prototypes don't work. Just get the feedback and keep going.
Yeah.
So 9 prototypes later,
nice.
They came out with a process that they have. They're actually exceeding their goals.
Oh,
so
incredible!
They changed the dynamic,
not just from a cash collection perspective, but just the engagement.
The culture of the whole thing.
The culture
for sure.
of the whole thing, because it was not just focused on financial, it was focused on the full package.
One thing we do, we've done this with several teams, is we always want them to go find an analogous situation where it's like something, people doing similar things but a whole different world. So the community, university financial aid officers, they said these are kind of similar. They have to, students who want to be there, they have to work out ways for them to become financially solvent or to make it work.
Sure.
So they went and talked to several counselors. They would actually approach the patient in a way like the university counselors did. That there's a lot of options. There's federal aid, there was hospital aid, there was local aid, there was different payment plans, there was just a lot of different, where universities had scholarships, grants, and loans. They found that they kind of had similar.
Wow.
And so they renamed themselves as the patient the patient access liaisons. And so they started, then they also learned that nurses didn't like them because nurses said, why would you be bothering our patients in the ED when they don't feel good? And they learned that if they didn't connect with them there in the ED, they were they were no longer eligible for certain financial aid or for certain aid for their.
Oh, wow.
And so they did some training with nurses, and then they also changed another thing. Is it used to be they would come into the patient. If Doug was a patient, I was one of them. I would come in and say, "Oh, can I have your insurance card?" And learn just right in front of the patient and come and see Doug 5 different times.
Sure.
Then they said, "Well, you know what? We could learn that before we go in." So now when they go in to the patient, they have all the information from them.
In front of them. Wow.
And they have gone from the last in collections to ever since the last prototype rolled out, they've brought in between 210 to 380,000 more.
Incredible. Wow, so they really grew their collections. Yeah, wow.
So their complaints have gone
Yeah.
from 2,000 a month to about 2.
Which is the personal, it's that connection, which is that's like amazing in terms of,
Connecting teams across the
yeah.
full platform and redesigning the process.
Yeah. But also, it sounds like connecting with patient. Which is extraordinarily.
Yeah. Connect with the patient in a different way.
And we've had just so many inspiring stories that what we're learning now after being open for almost 2.5 years is every single project keeps going farther.
Oh, wow.
Like we have this project that ran here. The stroke team came in and said they wanted to just reduce. They were an hour and a half on treating strokes, and they said we've got to get it under an hour. And they said when they came in, they said we want to shave 10 minutes off. We said 10 minutes. Got me to do more than that because it didn't seem that much, but they said no. Every minute is 20 million neurons destroyed in untreated stroke. Every minute matters in stroke. And they went to a PIT team crew and they studied how they operate. They redesigned the way that the patient in the ambulance is coming in, how they meet them wherever the ambulance comes in, what they have ready, how they talk to the family. They, at their first prototype, shaved 10 minutes off. Now they've shaved about 35 minutes off.
Oh, wow.
And they said that for every patient that ran the prototype and now how they're treating, it's a difference now to this.
Wow.
They are now, they have their sight, or they have their hearing, or they
my goodness.
discharged to home, not a rehab center.
Wow. Oh my gosh, wow. That's
But
pretty
to get to
tremendous.
your actual question, we were just rolling along, and we just said we're going to follow the journey. And then Doug had a connection with an outside company, and David had a connection with a large outside company. And they started saying, hey, maybe we could co-create some stuff together. And so we've just launched, we've been going with a couple of companies now. It's really taken a different trajectory. The internal projects will always be very important to us. They can never be outshined by any other projects, but we have a consistently growing number of companies that are coming in, and we're working on projects together. The company would come in, and it's not a sales. This is to get people to understand it's not sales, but just bring a medical or some kind of, say that, for example, and have the different departments come and just talk to you, learn about it. They go back and think, how can we use this and brainstorm? How might we incorporate this as a new application to healthcare?
Sure.
We've done it now 3 times, and we're actually
we're in research studies with one of them that could actually change the way we've taken care of patients post-surgery for the last, it's been kind of standard for the last.
Wow.
Right.
A protocol shift of some sort?
And so we
Wow.
just hired a person to help us connect with outside companies. But the exciting thing about Florida Hospital being one of the largest hospitals in the nation, we can bring companies in and they can get really deep empathy. What we mean by empathy is connecting with the end user.
Sure.
To really experience what they experience, to identify spoken and unspoken needs, and to really get new insights to how products or potential products could work.
Yeah.
There's a win-win
Sure.
for all of us. So
Oh, yeah.
On their
And
side,
Yeah.
to have access to 18,000 employees across our whole system.
Yeah.
In the process of taking something from concept to an end product.
Oh, yeah.
Getting that feedback early on from the end user being us in many of those instances. But it also allows us to have a win in helping us achieve some of the things we're trying to accomplish. So we've been working on a project with GE that we wanted to take the time of and shrink the time from diagnosis to treatment of breast cancer from about 67 days to 1. And we learned in the process that people really don't want 1 day. You need some process. You need some time to process, but it's a full continuum. So it involves private practice physicians, employed physicians, hospital services, etc. That all are part of this continuum. And after we've sat down and worked with our team and GE and involved physicians and patients on the project here in this lab, our employees, we've taken 24 days out of the process.
There was nobody giving women any options.
Yeah.
Do you want, as soon as we find a suspicious finding, do you want to be notified by anyone in this center, or do you want to hear from your doctor? Oh, I don't care, I'll just hear from anybody, or I'll hear from my doctor. And how fast do you want it done? And that was a big revelation in this project, that nobody was giving any women across the nation options. This is how it is, this you're going to hear from. And some women said, I'll go as fast as I can. Others said, you know what, my son's graduating, or my daughter's getting married. Let's just wait.
Yeah.